What's a sign you need to immediately go to the hospital? When you throw up, and it looks like coffee grounds. Losing the ability to see color in one or more eye. Sign of major issue in brain. I had a headache for a week, and was getting confused at work. 2 brain tumors and hydrocephalus led to immediate intake. You took a new medicine and your throat is closing up. Anaphylaxis can kill you. The worst headache of your life, which came on very quickly, also known as a thunderclap headache, even with no other symptoms. This needs to be looked at immediately. Could be any range of things, but what they are most concerned with is a ruptured aneurysm. Me, someone who has severe health anxiety, seeing this post, I should stay far away from that. Reads every single comment. Edit, I really appreciate the awards. Thanks. Edit 2. After reading up about this, I realized that I was misinformed about which term to use, and should have said somatic symptom disorder instead. Sudden hearing loss. The faster you get to the hospital, the better the chances of reversing it, statistically. In my case, I left it 2 weeks, and I'm now living with tinnitus. I'm a doctor, so anytime phone rings I gotta go. For women on birth control, serious shortness of breath, as in a relatively healthy person being winded just walking to / from car, and unexplained pain in your legs, mainly inside thighs, blood clots / embolisms. They can kill you very fast if they break loose and travel. If your shit is pitch black and grainy, it means you could be digesting your own blood and bleeding internally somewhere. Needs checked out as soon as possible. Gotta consult your doctor if this happens consistently. Edit, see comments below for some dietary and medicinal reasons this can happen that I wasn't aware of. In my case, it was due to an ulcer in the esophagus. Unfortunately, the bleeding caused digestive paralysis, so the symptom didn't show until after it was resolved. Another edit. This thread was more educational than I thought. Turns out there are tons of fun ways to safely turn your poop black, like Aureus and Guinness. Also Pepto for some people. I'm downgrading this from immediately go to the hospital to check with your doctor if this shit doesn't stop. Sorry for anyone that I unintentionally scared. That said, when it happened to me, it turned out to be quite serious. Yet another edit. Per advice in comments, if it has a tarry, sticky consistency and is black, get it checked out as soon as possible. This is a more telltale sign of internal bleeding than the black coloration alone. Also, if it accompanied by abdominal pain, get it checked out as soon as possible as well. In all other cases, it may still be worth it to call your doctor, describe the symptom, and tell them what you ate or drank. It's now been about 24 hours and the foot that was purple is now sort of blackish in color. Suddenly getting a massive headache and you aren't prone to them. A friend's work colleague died at work. She had a headache, took a paracetamol, then lied down in the fetal position. She started foaming from the mouth, and by then it was too late. Brain aneurysm. Edit. Whoa. I never imagined such a response to this. I made this post and then went to bed and came back to almost 100 replies and PMs. Sorry for everyone's loss. Looks like lots of others have been in the same boat as well. Signs of stroke. Face or mouth drooping. Arm weakness. Speech slurred. Time to call an ambulance. So think fast. When that wound you got on your foot by stepping on a rusty nail smells like rot. The ABC of first aid is A. Bone coming out of the body is a serious oopsie. If your pee is so dark that it looks like Guinness, go to the hospital immediately. Is this thread making anyone else's body feel weird, or is it just me? Haven't seen this one mentioned yet. If your newborn spits up bright green, solid sign there is a major intestinal blockage, even without any other symptoms, and there is a small window to get that corrected before death. I have forgotten mallet from my stable class, but I do remember that. Pain in nuts. Always get that checked out. You can lose them if you don't. Torsions are real. Edit. RIP my inbox. Holy shit. You were told 48 hours ago that you had gastroenteritis, stomach flu, and you did everything the doc said, and not only don't you feel better, you feel worse. There are a lot of things it could be, but gastroenteritis is probably not it, and some of the other possibilities are potentially lethal. When mine folded backwards was my sign. Wife had a pain in her shoulder and told me about it. Said it was uncomfortable, but not a big deal. I told her to send her doctor a message. Went in for an appointment immediately. She had internal bleeding from an ectopic pregnancy and had about 12 ounces of blood floating around in her. Honestly, the following altogether: lack of appetite, frequent urinating, vomiting, severe fatigue. Everyone thought my sister had the flu. But my mom took my sister to the hospital anyways. She had diabetic ketoacidosis. Her blood sugar was 717. She was almost in a coma. She was diagnosed with type 1 diabetes at 8 years old. Eater, I'm not a doctor. I only knew this because I witnessed my sister go through it. If you're experiencing these symptoms, please contact a doctor and get your blood sugar tested. If life gets good, really, really good, like too good, like you realize you're one of the most powerful people on the planet, like you realize you're smarter than everyone else, and that you're God's favorite, and you know, because he told you so, himself, with his words, in your head. If you have chest pain, and especially if it's combined with sweating, nausea/vomiting, left arm pain, and or a sense of impending doom. Eater, yes I know women present differently. Yes I know symptoms can vary by person. I was a paramedic. I definitely didn't expect this simple little post to blow up, so I apologize for not including it. When you are seriously considering killing yourself. A feeling of impending doom. Really? It's actually considered a clinical sign and can indicate impending stroke, heart attack, or other things. Can also be a panic attack, but if it comes out of nowhere and isn't associated with an own anxiety disorder, don't be afraid to take it seriously. Bleeding that won't stop. Sudden onset abdominal pain and vomiting. Appendicitis doesn't always present as pain in the lower right quadrant. If it bursts, you're fucked. You were bit by an animal. Always assume it was rabid. If you don't get rabies treatment within something like 48 hours, you could cross the threshold into guaranteed death. Growing pain in your back near your kidney stones. Go to the hospital before the pain gets unbearable. If you are completely menopaused and you start bleeding like a period, it is not a period and you need to go to the hospital ASAP. Also, if you have been electrified but you feel fine, still go to the hospital because blood clots are no jokes. Skin/white of the eyes turning yellow. This probably caused by accumulation of bilirubin in the blood, which can be caused by severe liver failure. Rectal bleeding. Several things can cause this, from hemorrhoids all the way up to massive gastrointestinal hemorrhage. Some people won't go to the hospital out of shame and embarrassment in these cases and end up bleeding out in their house. Go to the hospital. Throwing up coffee grounds. For teenagers and young men, sharp pain in a testicle could be testicular torsion. If successfully treated within 6 hours, it is often good. However, if delayed for 12 or more hours, the testicle is typically not salvageable. About 40% of people require removal of the testicle. After they announced Bob Saget's cause of death, I saw this get discussed. So, if you had head trauma, even if you don't feel anything, go get immediate care. Apparently it can just go omi wa mau shidaru on you, just that simple. If you think something's infected, i.e. dog bite/other, lost a toe after I stepped on a small nail at a house I was helping renovate. Didn't think much of it until it started leaking pus a few days later, because I didn't think much of it. Blue nails. Pallor face. I was young then, and didn't know what's happening. Mom rushed me to hospital right away, where I was immediately jabbed in the butt. Nurse said any later it would be too late. Course, contaminated food. Not so fun fact about hospitals. My fiancé doesn't have health insurance and just went recently for left flank pain. They ran some blood work and gave her morphine. She was out 4 hours later with the doctor saying musculoskeletal and told her to ice it. $8,000 bill. Edit. I'm sorry, $9. 023. 94. Me clicking on this post. Oh boy. Time to scare the shit out of myself. Can't wait. For women who are currently banging, sharp pain in the tip of your shoulder. This is a major sign of an ectopic pregnancy, and maybe the start of internal bleeding. Hypochondriacs freaking out. Very dark brown urine. Went into urgent care over 2 weeks ago because I had a rash/fever, and they told me it was probably a virus. The next day my urine had turned dark brown, and I went to the because I knew it was a bad sign. TM. Turns out I had sepsis and a life-threatening drug allergy from the antibiotic I was on. 2 surgeries and 9 days in the hospital later I'm alive, because I recognized brown pee as bad. Uncontrollable bleeding. Unable to rouse, i.e. unconscious. Not sleeping. Unable to breathe. Skin changing color. Severed body part. Bone sticking out or obviously no longer supporting the body part. Suspected venomous bite, growing red or black ring. Suspected dangerous overdose of medication or alcohol. Persistent body aches and severe flu-like symptoms. Burns resulting in significant tissue damage. Foreign object lodged in body. Body temperature over 103. Welp, my appendix just exploded inside of me 3 days ago, and my tell was that just standing or moving at all became excruciatingly painful. So if normal activities are causing pain, especially severe pain, like I was feeling, maybe consider calling 911. Sudden increase in floaters in one, or both, and or something like light flashes in your eyes or eye. I'm to call the eye hospital I go to, but call an eye clinic or hospital or room and haul ass. Might be a retina detaching. Not a bad fix, if they catch it in time. Very time critical. My eyes have a few issues, so pretty much every time I see my ophthalmologist he reminds me to call, if I even suspect it is happening. Happened to my mother. Caught in time, not a big deal. Super low blood pressure. Otherwise I would probably sit on the couch until I died. A red line heading towards your heart. It's blood poisoning. And will kill you. When your face starts to droop. A baby is coming out of you. Pupils different sizes I believe means you need to be in hospital right now. Edit, I have no idea why this is. It's just something that's always freaked me out. I'm sure there will be some doctors etc here who actually knows what the deal is. I feel so bad for those of you in the US who are saying things that are so insanely dangerous that it shouldn't even need to be said. You need to go to the hospital. Meanwhile I'm sitting here about to give a list of comparatively small things that could be an indication of something bigger, because in my country you don't get charged for going to the So when things seem off, the hospital is a realistic option to get to the bottom of it. Whereas in the US you'll are waiting till you're on death's door before going, even though it's completely treatable when you catch it early. I don't even care if I get downvoted. I just genuinely find this sad. Your innards have become your outards. When you puke blood, or if you're an everyday alcoholic, 12 to 24 beers a day minimum, and has no choice but stopping. Go to the hospital. It could save your life. True story. It did for me. Update. For those who wants to hear full story. Yeah, it's freaky when you start vomiting blood. I was always drinking. From 7 AM to the end of the day. Usually when I run out of beer after 24. I did a seizure, my second, and had to go to the hospital for a few weeks. Had Valium to help with withdrawal. Liver hepatite 2. I stopped drinking for 2 months. I now have a job, was unemployed for 2 years. Well, I sadly started drinking again in the last few months. But I have control. Well, close bracket. Never before working. Just when it's late, and no more than 12 a day. At least I'm off drugs since a while. Well, / not proud of it. But you'll see how it goes in a few weeks. Any kind of cognitive issue. A friend of kind passed away recently because of a brain tumor roughly a year after diagnosed. First signs were word finding issues. Lasting pain. Same friend. A year before his brain tumor. He had tumor on the lower part of his spine. His spine hurt for years. Never had it checked out until it was late. The treatment for that made his brain tumor untreatable. Because the combination of the two treatments would have killed him even faster. When everything you type is suddenly gibberish. Went to the ER thinking I had a stroke. Came out of the hospital a week later with a manuscript diagnosis. Going quickly prevented the damage to my brain from getting worse. Same vein. If you look down at your feet and electricity shoots up your body in a wave of tingles. That's your spinal cord being eaten by your immune system. See a doctor. If you have to ask, it's time to go. Thank you for watching. If you enjoyed this video, don't forget to drop a like. If you would like to see more content like this in the future, subscribe and turn on notifications to be notified about future videos. Now check out one of these interesting videos.